Welcome. Today we are going to conclude the series on how to read an X-ray. This is the part third of the lecture series and it will be the conclusion. Now, once an X-ray is given in front of you as a student in your undergraduate or post-graduation, one is supposed to read the X-ray. So how do we begin reading the X-ray? So let's see and learn the following things. So first of all, the first thing that you have to see is we have to verify the patient details. Meaning you have in today's the today's X-ray that we have are digital X-rays. V- who- They have some information regarding the patient's name on the bottom or on the top side of the X-ray. For example, this X-ray is of Mr. Shravan Lal, and so the first thing that you will note is the patient's name. After that, there is the date and time. So you will say this is an X-ray of Mr. Shravan Lal taken on 27th December 2022. Sometimes date time is also given at 1:28 p.m. So after that, the third thing that you are going to address is we have to speak of the X-ray part, meaning this X-ray is of the knee joint of Mr. Shravan Lal taken on 27th December 2022. After that, we have to make a statement whether this X-ray is of a skeletally mature person or not. So the X-ray, as we can see here, is that of a skeletally mature patient. So we can say that this is an X-ray of the knee joint of Mr. Shravan Lal taken on 27th December 2022, and it seems to be a skeletally mature person. Then we have to speak about the side. Here, the X-ray, there are four X-rays printed on one single film. These are the lateral view of the right knee, lateral view of the left side. Then we have a skyline view of the right side and the skyline view of the left side. So if only this X-ray is given to you, you have to say that this is a skyline view of the knee joint of the left side. So always begin, once again I'll repeat the things, that we have to verify the patient's name. Most important, you may be standing on bedside of a patient and some other person's X-ray could be deliberately given to you. So you have to confirm the identity of the patient by looking for the name of the patient, identifying the name, then the date, then the part of which the X-ray is taken, and then whether the patient is skeletally mature or not. For example, in case of children, we'll have the open physis by which we can say that the X-ray would belong to a skeletally immature person. Then the side. So the side, usually the X-rays come with a marker, like here left L stands for left and R stands for right. So as I said, in the children, we have some the physis would be open, so a lot many things change in the description of the X-ray, especially in the pediatric age group. So now the next thing that you are going to say is, once you speak about the things that we discussed in the previous slide, now we have to identify the fracture, and also we have to tell about its location. Then the second thing that we are going to speak about the fracture is that we have to tell whether it's a complete or an incomplete fracture. Then the type of fracture. The type of fracture that we discussed in the first series of the lecture side, if you have not seen, I'll put an I button here from where you can go back to that lecture. That is very important to know which type of fracture pattern is it. Then you have also to describe whether the fracture is a displaced or an undisplaced one, And also one has to look for the joint above and below to rule out either a segmental or a fracture extending into the joint. So this is not an elbow, this is below. This will be below. So now, how to describe beautifully in front of an examiner and to impress upon him? Uh, let's learn. So the first thing is that you will describe the patient's age, and you will introduce him as a Mr. or Miss or Mrs. So you have to give information about the patient and a relevant comorbidity that is important in orthopedics. The second thing that you are going to say is about you have to tell about is the mechanism of injury. For example, whether it's a high velocity injury like a road traffic accident or fall from height, or a low velocity injury like the fall on an outstretched hand or a slip. Then the third thing that you are going to speak about is the time or the onset of the injury. For example, whether the injury is acute, subacute, or chronic. Then you have to speak whether the fracture is a closed one or a compound one. So we discussed this in the second lecture. If you haven't watched the video on the compound fractures and closed fractures, I'll put an I button here. Kindly you can go back to that video and learn the difference between the two before going ahead. Then we have to describe the fracture and its location with a relevant classification. Then the next thing that you are going to speak about is the distal neurovascular status. Very important. You have to examine the distal pulses and look for the neurological examination. Then the last thing that you are going to do is, in case of an upper limb injury, you have to speak about the dominant side status. It's a very important thing which most of the people forget because it has an impact upon the decision making. In fact, all of them, once you describe them in such a manner, will give the examiner the idea that you know a lot about the subject, and also it would help in devising the treatment protocol. For example, now we have an X-ray like this. Let us try to read this X-ray. This X-ray is of the left wrist joint, the AP, and the lateral views of a skeletally mature person, where we can see a transverse fracture of the distal end of radius and a fracture in the ulnar styloid. Here you can see the fracture in the AP view, and here a fracture in the lateral view. This fracture is a complete fracture and it's a non-displaced transverse type of a fracture. So now how to present this X-ray once it is given in front of you, in how to present it in a nice way. So you have to introduce the patient to the examiner. Like here, there would be patient information. The patient information and the date and time is missing. So you are going to say that this X-ray is of Mr. Ashwin, a 25-year-old law student, which was taken. You have to mention the date and time. That is not mentioned in this X-ray. For example, it is taken on 27th of December on 2022. This 25-year-old Mr. Ashwin, who's a law student, doesn't have any comorbidity, presented to the emergency room with history of a fall on an outstretched hand 1 week back. Now comes the X-ray that you have read, that also you have seen the patient clinically. So it's a closed, undisplaced transverse fracture of the distal end radius with fracture of the ulnar styloid. This will be a Frickman type 2. So you have added a relevant classification to it with intact distal neurovascular status of the non-dominant left side. So as I said in the previous slide, that in case of upper limb you have to speak about the dominant side. So this is the left side, and this would this would be probably a non-dominant side for Mr. Ashwin, so you have to speak about that. So the things that we missed here were that we didn't speak about the date. So the date is missing in case of this, and also the patient's name on the X-ray film. So you have to be very careful about it. There may be a trick question in the exam. You always have to identify the patient's name and date on the X-ray before proceeding ahead. Otherwise, this could lead to a lot of problem. So coming to the next case, here comes an X-ray like this. Again, the name of the patient, the date is also missing. So you have to, we'll consider it that the name is there on the X-ray because the whole of the X-ray was not could not be put up. So the name of the X-ray is the name of the patient is printed on the X-ray along with the date. So here we can see this. There's a fracture of the shaft of the femur, and it is quite comminuted and segmental. There are a lot many pieces. You can see there's one piece like here, one piece like here, one piece here, one piece. So this is a comminuted segmental fracture of the shaft of the femur. So the left and right side is not written here. So for the sake of learning, I'll put a right side on this X-ray. So we'll just say that it is on the right side, suppose. So, so 40-year-old Mr. Ravi, who is a bank employee and a known case of type 2 diabetes mellitus on injection insulin, presented to the emergency room with alleged history of road traffic accident. It's a pedestrian injury and the injury took place one day back. And now we'll come to the description of the femur, that it was, once you have seen the patient clinically, the patient had a compound type 3B, comminuted segmental displaced fracture of the femur of the middle third. Now you add the the relevant classification, that was the Winquist and Hansen. It is a type 4 and with intact DNVS of the right side. So always speak about the side as well. So the things that we have not mentioned here would be name on the X-ray. Again, very important. Never forget about this part because you have to begin by confirming the or verification of the name of the patient on an X-ray. So coming to the third X-ray, again here the side is mentioned, left side, but the name and dates are not mentioned. So you have to first of all identify the patient. Now supposing that you have learned the art of presenting the X-rays, we'll just try to learn how to read this X-ray. So here this is a X-ray of a skeletally mature person on the of the left side, showing the leg and ankle. The it's not a complete leg. You are able to see only half of the leg and the ankle joint. There is a fracture here of the tibia. It's an undisplaced complete transverse sort of a fracture of the middle third. So you can say a closed, so you have seen the patient also. So closed undisplaced transverse fracture of the middle third of the tibia on the left side with intact DNVS, distal neurovascular status. So again, another X-ray here. Patient name and details I have not deliberately put because of the things for the privacy sake. So this is a mark here showing a left side. So again, this is not a complete X-ray because you are not able to see the proximal leg. There could be a fracture that would be here. So you always have to have the complete picture of the X-ray. So once a X-ray is given to you like this, you could ask the examiner that these are incomplete X-rays. I would like to request you to give the X-ray of one joint above. Means you have to see the full length of the leg along with the knee. Suppose that is normal. So how to describe this? There is a spiral fracture of the tibia of the left side in the distal third. So again, you see the patient clinically and tell the examiner that's a closed spiral fracture of the distal third of the tibia on the left side with intact distal neurovascular status. So let's go to another case here. Again, the X-ray is incomplete. Always try to say that the X-ray is, sir, I would like to see the X-ray of one joint above. That is I would like to see the knee joint. So here you can see a lot of comminution here in the middle third, in the shaft of the tibia on the right side, with a segmental fracture of the fibula. So it's a fracture of both bones of the leg in the middle third, with a comminuted fracture of the tibia with a segmental fracture of the fibula. So depending whether the patient has this thing, this patient had a compound type 2 injury with fracture of the both bones of the leg of the right side, in the middle third with comminuted fracture of the tibia, and a segmental fracture of the fibula with intact DNVS. I hope you liked the video, and watching these three videos, I hope you would gain the confidence to speak about the X-ray in a very nice manner to the examiner. Thanks for watching.